Hey everyone, welcome to another edition of Medicare Monday. I'm your host, Joseph Katz, here again with CoverRight co-founder Richard Chan. How are you today, Richard?
I am doing very well, Joseph. How are you?
I'm great. So I want to talk about the Medicare Donut Hole. Who doesn't love donut holes, right? Yummy. I have a feeling though, when it comes to Medicare, it's not going to be so yummy. So let's talk about the Medicare Donut Hole and what is it and
Yeah,
how does it work, and we can jump in from there.
yeah. I think you're right. It's definitely not as yummy. So the donut hole is one of the four phases of prescription drug coverage in Medicare. So within Medicare, there are prescription drug plans. There are two ways to get it. You can buy a standalone drug plan, or you can get your drug coverage through a Medicare Advantage plan that's bundled in. Either way, the drug coverage works the same. There are always four phases to the coverage. The first phase, and I'll go through all four just so we have the context. The first phase is the deductible, which most people probably understand. That's the amount you have to pay first before the insurance kicks in. The second phase is called initial coverage. This is the phase where each plan will have their own list of fixed co-pays and co-insurances that you would pay for a 30-day supply of drugs. So for example, it might say, a tier one preferred generic drug is a $5 copay for a 30-day supply, and that might apply for the period, or a 90-day period might be like a $15 copay. That initial coverage phase only lasts up until the total cumulative retail value of your drugs claimed throughout the year reaches $4,430. So if the retail value of your drug reaches $4,430, you enter what's traditionally called the donut hole.
So quick question. When you say retail value, that's not the negotiated rate, right? So if the drug company is charging $100 for that prescription, that's what they're using?
It's basically the rate between the pharmacy and the carrier. So it is really like the retail value that you would be paying. And so, yeah, it's not just your copay, it's what your plan is paying as well. So the combined amount that you're both paying would equal the retail value of the drug. And so once that reaches $4,430, you enter what's traditionally called the donut hole, or the more technical name is called the coverage gap. Now, why is it called the donut hole? The reason is during the donut hole phase, you actually, instead of paying those co-pays that are $5 or $15 for a 90-day supply, you have to pay 25% of the cost of drugs. Now, you actually used to be higher than that, but that's the rate now. 25% of the cost of drugs. So for most people who hit the donut hole, they will actually see their monthly expenses go up, step up because of that reason.
And that 25%, that 25% is on the price, the retail price.
Of the price of the drug, yeah. So if the retail price is $1,000, you pay $250. If it's $100, you pay $25, basically. The donut hole doesn't last forever. There is a final stage of drug coverage called catastrophic coverage. Catastrophic coverage kicks in when the total out-of-pocket costs attributed or credited to you reaches $7,050.
And that includes the first $4,430.
So here's where it's tricky. The $4,430 is based on retail value of the drugs. So you plus what your plan pays. The $7,050 is based on what you pay as well as what is credited to you. Now, why I say it's important to understand what's credited to you is it's not the fact that you have to pay $7,050 out of pocket completely. The reason for that is during the donut hole, you actually get additional credits above and beyond what you pay. So you are paying 25%, but you actually get closer to 95% credit because there's something called a drug manufacturer discount. So the manufacturer is giving you a discount on those drugs. Those discounts also are credited to you. So it's not really you have to hit $7,050 out of pocket just for you. You get some credits, but it's also a different measurement than the 4,430. So that's why it gets confusing.
So picking the right drug plan is pretty important, right? Because the cost of your drugs, once you're in or out of this donut hole, could impact what your out of pocket is, right?
Yeah, typically you want to pick a plan that obviously covers your drugs during that initial coverage phase. Normally, it really depends. Normally, if you have a very, very expensive drug, we've seen it where clients hit catastrophic coverage in the first month or second month because the total retail value of the drugs per month is already $4,000. So over 2 months, they're probably already at that catastrophic coverage. So when you're in that situation, it's important to understand what the costs are in catastrophic coverage, because that's what you're paying for most of the year.
Once you hit that catastrophic coverage, you don't have to worry about the donut hole. You're just going to be paying that 5%. You pay 5% of the cost of the drug. It's basically 5%. There are some lower benchmarks if your drugs just happen to be cost lower than $10 a month, but the rule of thumb is 5%. And this applies to everyone, no matter what drug plan they're on, whether it's Medicare Advantage drug plans or supplemental drug plans. Everyone has the same. It's a federal.
Yeah, the limits might change. So the 4,430 might go up next year. The 7,050 for the catastrophic might go up next year. But they all have those 4 phases, and the way the math in terms of like retail value that accumulates towards that initial hurdle, and then the out-of-pocket costs that you pay that accumulate towards that catastrophic coverage hurdle, like they are the same across separate drug plans and Medicare Advantage plans.
There's no way to avoid this, obviously. Was there any advice you want to leave us with on how to manage drug costs?
Yeah, there's a few. So firstly, if you're coming up to 65, what we would typically recommend is talk to us early in the process of when you're considering Medicare, because we have had situations where we've been able to tell a customer of ours that a certain drug is going to cost a lot. And if the doctor can prescribe an alternate, they may be able to get a lower cost plan. So doctors don't know the cost of drugs that they're prescribing per se, particularly under your plan. And so they might not know that. They may know there's an alternative, but they might not know that that's significantly cheaper. And so that's one. The second is it's worthwhile sometimes looking at alternate ways of paying for some drugs like GoodRX, or one thing that we're launching here at CoverRight in a few months is the ability to compare across GoodRx and actually Mark Cuban's new cost plus drug company.
Yeah, I was going to bring up Mark Cuban's plan. I was just listening to something about his program. He's got some press recently about it.
Yeah. And so there are alternates popping up, and our goal at CoverRight is to give you the interface and the technology to be able to easily digest how to minimize your drug costs.
Excellent. Richard, I'm sure there's more to dig into this as people have specific situations, so they can reach out to hello@coverright.com and talk to one of our advisors about how the donut hole may or may not impact their Medicare coverage. If anyone has any questions about Medicare in general, the team's always happy to answer them at hello@coverright.com. And our learning center is free to use and poke around and watch old videos, podcasts, etc. That's learning.coverright.com. And obviously, we highly recommend people subscribe to our channel for more updates as they come out. And we'll look forward to speaking to you again soon. Thanks again for your time, Richard. Thanks, everyone, for joining us.
Thanks, Joseph.